Okay guys, so in this video what we're going to do is go through a dynamic little lunge series to open up hip flexors. And the hip flexors is something that, and hip extension particularly, is something that has a huge impact on lower back pain and lower back discomfort. And I find that doing these lunge type series is really effective for lengthening the hip flexors, getting some, also get some good rotation of the thoracic spine. So it's really nice, I find, for lower back patients. Sometimes I'll use it even in shoulders as well, because you get this dynamic movement of the shoulders. Obviously it's more of a late stage rehab exercise that you would give. So we're going to stretch the hip flexors in 3 planes of motion: sagittal, transverse, and also the frontal plane. So what we're going to do with Patrick is just do a sagittal plane movement first, so a reverse lunge with the arms coming up in the air. So do that, Patrick. It's good. And back up again. Just making sure he squeezes the bum. Just do one more for me. As he comes back, perfect. And making sure that his right knee really extends back. We want a good hip extension, and we want the glute to be squeezed on the right hand side, which is going to lengthen through here. As you bring those arms up, again it lengthens through the whole of the front of the body. Really nice stretch through here. Then we're going to do more of a rotational plane. So we're going to go into that the reverse lunge with rotation. We go for that. So he's just rotating over the leg that's forwards, which means again that he gets more of a stretch through his right hip flexor as he does that. Again, similar thing, perfect. Similar thing in the sense that we're getting the bum squeeze. I always get this posterior tilt, this bum squeeze, which again is going to lengthen through the front more. A lot of people spend so much time sitting these days that they get really tight through the front, so doing this one can be really helpful as well. And then the last one is more of a frontal plane movement or a lateral movement or lateral lunge. So we're going to reverse lunge, but we're going to do a lateral bend to the left. Again, all of these, and back up, perfect, and then one more. All of these are stretching his right hip flexor. It's good, and back. Same thing again with that one, nice extension. The thing you have to be careful with this one is that people get a side bend from the lumbar spine. Some people, what they'll do is they'll just do that with their arm, and they won't really be getting much side bend. So it's really, sometimes what you can do is facilitate these movements. So again, we'll just quickly go through that actually as well. So let's do your rotational lunge again. Okay. So reverse lunge with rotation to the left. And what you can do is actually get a little bit of facilitation and then come back up. So all the way back up, it's good, and again. And just facilitating, they usually go through those shoulder blades and back up. So you're facilitating that rotation, it gives a bigger stretch, good for the thoracic, but you also get more through the hip flexor. So then the last one you can facilitate is the lateral lunge with a side bend. So Patrick, if you do that lateral lunge for me, reverse lunge with a lateral bend. And back up. So again, I'm facilitating on the pelvis on the left. It's good, and relax. And on the upper back and shoulder blade on the right. And just creating that lateral bend so that it's not just from the shoulder. So all 3 of those movements with facilitation, really, really nice for getting increased hip flexor length, great for lower back pain, good for knee pain a lot of the time as well, because if we can create better extension of the hips, that often is really helpful, particularly in runners and things like that. So fantastic exercise to dynamically improve those hip flexor flexibility.